Um, I am I'm attempting to do something tonight in an effort to make sure that everybody who would see this or who would want to see this or who needs to see this will get to see this. And I'm going live on my personal page via my phone, and I'm broadcasting down here through my regular platform to YouTube, to the Rantings of Danny page, and the other Danny Cook page. I'm doing that because my personal page is where the most followers are. It's where the most people view. And the drawback is that I can't necessarily see your comments. I can't see them if I do it through the streaming software. So I'm going to give it a minute for everyone to get in here. Let me preface this by saying I know I normally greet everybody when you come in. I'm not going to do that tonight because I have a lot of information to cover. So just forgive me for not acknowledging you all. Know that I see you. Know that I love you. And very briefly, I'm going to remind you that an independent film studio here in Atlanta would like to give me my own talk show, and we are raising funds to make that happen. If you are watching on this stream down here, you will see a link. Sorry, that's the wrong one, but that one works too. You will see a link to the DannyCookShow.com where you can find more information out about the show, about tickets, about becoming a sponsor or donating. That's my PSA for that. And now I'm going to dig into why we're all here today to talk about this issue. Okay. So I know that many of you following have been with me for a while, and you are familiar with Ballad Health, and you know how we got a medical monopoly, but a lot of people don't. And there are people watching tonight who need a little bit of a backstory. And so if you will please give me your grace for just the first few minutes. And I want to explain to people why Ballad Health as a healthcare system is different. Ballad Health is a legal medical monopoly that was created by the state of Tennessee, the state of Virginia, a bunch of politicians and business people. And the reason why it's different is because it exists underneath what is called a certificate of public advantage. This is a document that this is a law actually that was created specifically so that two different independent healthcare systems, Wellmont Health System and Mountain States Health Alliance, could merge together into one healthcare system. Okay. Now, you might be saying, well, why is that a bad idea? Let me explain to you what happened. There was a piece of legislation already on the books called the Hospital Cooperation Act of 1993. The Hospital Cooperation Act was designed with the intent to allow hospitals that were struggling and that were in rural communities to be able to work together, to cooperate, to share referrals, to share physicians, to share equipment, so that even though competition was there, the competition wouldn't hurt the businesses. The idea was to be able to allow healthcare systems to work together so that you could maintain the integrity of competition, the benefit to the public that comes with competition, and still help hospital systems thrive. But business people and legislators decided that wasn't enough. They wanted to merge these healthcare systems, and they wanted the antitrust protection that comes with working with the government. And there were some specific politicians who put this in play. Some of them were already not reelected. Some of them are up for reelection now, and it's important that we do our level best to eliminate them from office. So on the Senate side, Senator Rusty Crowe participated in this process. Matter of fact, he sponsored the legislation. In addition is Hawkins County Representative Gary Hicks. In addition is Senator John Lundberg of Bristol. In addition is Bud Halsey also of Sullivan County. All of these politicians played a role. I want to very briefly share with you a snippet from Rusty Crowe, Senator Rusty Crowe and Senator John Lundberg speaking at the local COPA hearings on June 7th, 2016, when they were advocating for the creation of a medical monopoly against the Tennessee Constitution. And it's important to note that at the time that Senator Rusty Crowe was doing these things, He was a contracted paid vendor for Ballad Health and continues to be, has been for over a decade. So I'm going to share that clip with you right now.
Both systems together to formally apply for permission to merge, essentially convincing the Department of Health and the Attorney General's office that the merger would be to the advantage of the region, such that the health care provided is as good or better, and hopefully I think in this case it can be better from various perspectives than it was in the past, or that it would be in the future had they not merged especially. This COPA will require the Department of Health and the Attorney General to continuously monitor, which is a good thing, the newly formed system. It's kind of like a Community Protection Act, I think. It controls pricing, cost, quality, things like that. So I feel very comfortable that this is the right solution, and that this whole process has been developed in partnership with the state. And as you said, that is a good thing, looking at the precedent that's been set in Georgia and North Carolina with regard to making sure that that state action immunity is in place, which essentially says that when you work in partnership with the state, then the systems that are involved have that same immunity as the state has. So it will allow us to control our own destiny, have some very large hospital systems from outside not come in, potentially for-profit systems that might have come in that don't understand our area and provide a situation where we couldn't really control our systems as we know we should for this region. And it will provide for, as I said, tremendous opportunities for research, technology, physician recruitment, quality care, reduction of overlap of function, with those dollars going back to the community. So, Commissioner, I'm very positive on this approach. I think I appreciate the work you guys have done. It's been a long process, but I think one that I think we'll all be proud of. And we appreciate the work that you and the department have done and are doing to make sure that the advantages do outweigh the disadvantages.
Now, that last part is important, and that's the reason that I cut that clip at that mark. So bear with me. I'm working two systems because I knew more of you all would be on my personal page than on the other one. So give me a sec. I got to put you guys back up here. Bear with me. Swear to God, I'm trying. Now, tonight's broadcast, sorry. The reason why that clip is important, and the reason that later on in the show, I'm going to introduce you to candidate for Rusty seat, Kate Craig, is because I think it's wrong. And I think many of you think it's wrong for a paid politician on the payroll of a healthcare system to introduce legislation on their behalf. And then when it comes before the committee to vote, to claim Rule 13, which Rule 13 says, yes, I personally benefit from this legislation, but I promise that my vote is for the people. No, thank you. We need a different option. So I'm going to introduce you to Kate, and I'm going to let her speak on some things a little bit later. But right now I want to talk about the disadvantages of Ballad Health. I want to talk to you about public statements they made specifically about their internal investigations, statements that they made to you regarding their self-reporting processes, specific statements that they made regarding Greg Neal, the CEO, who we now know made an incision into a patient's chest with no medical license whatsoever. And also a discovery that I made yesterday afternoon. And when I tell you, this for me is probably one of the top 5 broadcasts I've ever done on Ballad Health. So stay with me. It will be a little bit of a lengthy night. I promise you it will be worth it. And I owe it to one family in particular to take my time and to give you all the details. So now that you know how we got a COPA and you know that it eliminated competition, one of the things that's very important for you to also know is that it gave antitrust immunity to the healthcare systems because they were working with the Tennessee Department of Health, right? Because they had active continuous oversight, which you heard Senator Crow talk about, it gave them immunity from antitrust laws, okay? The FTC fought this thing, but it still passed. I want to show you a clip when Rusty Crowe introduced this legislation to the Senate Health and Welfare Committee. A very important senator had some questions about it. His name is Senator Doug Overbay. Now, you may know Senator Doug Overby's name because he went on to be a United States attorney appointed by Trump in 2017. Senator Overbay had some questions about this piece of legislation that are really, really important. So I'm going to have to stop putting you guys up here and taking you down and just keep you down, if that's okay. Y'all are going to be getting like this really ugly view of me, but I got to do it. So this is a clip where Senator Overbay had questions about the legislation for the COPA, and here's what it says.
You've heard a thorough explanation of the amendment. It's been properly moved and seconded. Are there questions on the amendment? Seeing none, all those in favor of adoption of committee amendment number 1 will say aye. Aye. Opposed, no. You adopt. We're back on Senate Bill 994 as amended. Is there further discussion? Seeing none, Senator Overby, you recognized.
Thank you, Mr. Chairman. I have some questions about the detail of the proposed amendment. I know this bill has been also moving through the House. The House adopted a different amendment, or at least the last action I'm aware of in the House. I obtained a copy of that amendment and started reviewing it yesterday, and then got, while we were in Judiciary Committee.
Don't worry, you're still live. It froze for a second. I refreshed it. It's coming back.
Last evening got delivered a copy of what was going to be offered today, which was different than the House amendment. This is a very comprehensive and wide-ranging amendment, and a lot to digest in a short period of time. Be that as it may, one of the in addition to some of the technical things that are in here, like the supersedious bond and why the need for that, will that discourage appeals? There's also where if the intervener takes an appeal and loses, the intervener is responsible for a certain cost and expenses. On the other hand, I didn't see a provision that if the intervener should prevail before the department and the applicant's appeal, that there is a provision for the applicants to pay the intervener's fees. It always strikes me those sorts of things should go both ways. But be that as it may, I have been wondering why the need for the legislation. At least in Knox County, and Dr. Briggs can speak to this probably more thoroughly than I can, but in Knox County, you had St. Mary's acquiring Baptists. That was done without a need to amend this statute. And I heard the sponsor talk about one of the reasons is to address the merger issue, but we had two systems merged, or however they did it. I wasn't involved in the transaction, but St. Mary's acquired the Baptist hospital, and then HMA acquired St. Mary's, and then CHS acquired HMA. So there's been
this is important.
Lots of transactions in the East Tennessee area that I'm aware of that were able to be accomplished without amending this particular statute. And I just, it strikes me, why are we needing to do this? And I understand there are these talks. I guess it's been announced up in Upper East Tennessee, but I'm just wondering why we are doing this. And I guess the bottom line is competition is good. And I favor competition. And why are we needing this statute?
So listen, so Rusty goes on after this to stutter a little bit and make some excuses and what have you. I'm not going to play the rest for time's sake, but Senator Overby comes back and says, well, look, it appears that the reason that you want to do this is simply to get around antitrust laws. And as a matter of fact, that's what the bill says. There's a second piece. So let me just explain. I have been fighting tooth and nail to get some of these documents for you all for tonight and have run into resistance. And one of the things that you need to know is that Rusty Crowe passed a second or introduced a second piece of legislation called SB 2048, which gives Ballad Health a lot of protections. You heard Senator Overby talk about one part of this legislation, that if you wanted to intervene and stop, let's just say that you live in West Tennessee or Middle Tennessee, and somebody decides that you need a medical monopoly. According to this legislation, if you try to intervene in that process and you lose your court case, number one, before you can even go to court, you have to put up an appeal bond, which you heard Senator Overby says he believes would hinder your ability to have due process. I think that violates the 14th Amendment. You also heard him say that it says that if you try to block a COPA where you live, and folks, if you think this can only happen in Upper East Tennessee, you're mistaken. Then, and you lose that court case, they actually put it into the law that you have to pay the attorney's fees of the healthcare systems that you're trying to block. What it doesn't say is that if you win, they have to pay yours. Senator Overby hit it right on the head, and now we are seeing the repercussions. So one of the things that was huge after Ballad Health was granted this COPA was in November of 2018, on November 14th, 2018, they made an announcement. And that announcement was that they intended to downgrade Holston Valley Medical Center's level 1 trauma. They intended to downgrade or eliminate the Holston Valley Medical Center neonatal intensive care unit, which you all know is the unit that saved my grandbaby's life. And they intended to downgrade Bristol Regional Medical's level 2 trauma center. Now, we were told that this would not impact the quality of care. We were told that even though a level 1 trauma center is required to keep 28 specialists on staff or in-house 24/7, and a level 3 is only required to keep 4, we were told Ballad would still keep people. We were told this would not be impactful. I'm going to share a story with you later about a case that happened 5 weeks after Holston Valley Medical Center was downgraded. And I can promise you, I have talked to a physician familiar with Holston Valley and its staff and its procedures. And in their expert medical opinion, the downgrading of Holston Valley Medical Center's level 1 trauma had a direct impact on the level of care that this patient received. Matter of fact, this expert's words to me were exactly, yes, absolutely, when I asked if it played a role. Now, fast forward a little bit, because I need to take you through 3 separate things that have transpired in the last 2 years. I want to talk to you about a cluster of cardiac deaths that occurred in February of 2020. And then I want to talk to you about 7 months later, when Bristol Regional Medical Center's former CEO, Greg Neal, scrubbed into a cardiac surgery and took a scalpel and made the initial incision into a patient's chest. And then I'm going to talk to you about the discovery that I made yesterday following about the trauma patient that I'm talking about. So bear with me. They are 3 separate things, but they do go together. They are relevant to one another. So when the cardiac cluster deaths occurred in February of 2020, I was told on February 17th that it had occurred by an employee who was concerned that although 3 patients in the last week had passed away following a cardiac procedure, that at that time Ballad was still doing cardiac surgeries, and they had just started to try to track down what had happened and if there was a commonality in these patients. Now, if you all remember, I reported on this story on February the 19th. And what I reported to you then, and you could go back and watch that live broadcast, was that at that time, 3 patients had passed away after developing a sepsis-like condition following cardiac surgery at Ballad Health Holston Valley Medical Center. In that broadcast, I stipulated that I was not saying that Ballad had done anything wrong, that the reason I was sharing that information was because the employee that reported it to me was concerned because at the time, cardiac procedures hadn't been fully stopped. The public had not been made aware, and they control 97 to 98% of all inpatient care. So if you were going to have cardiac surgery, they were your only choice. So before I did that broadcast, I contacted the Tennessee Department of Health licensure for healthcare facilities, and I filed a complaint so that they could investigate on their own to determine if anything went wrong. Now, when I talked to that investigator, that surveyor, I shared with her the information that my source had given me. In addition to that, I shared with her several other stories, several other instances regarding patient care. One of them was from a trauma accident in 2019 and in the fall of 2019. And I gave this investigator as much detail as I had, and she took notes. She contacted me the first week of March in 2020 when she was on site investigating the complaint that I had made to her. On April the 16th, I received a letter from the Tennessee Department of Health, licensure for healthcare facilities, informing me that based on the information that I had given to them, this is what their letter to me said, based on the information that I had given to them, the surveyor had made a visit March 3rd, 2020 through March 10th, 2020, and determined that Ballad Health had in fact violated rules and laws at that facility. I contacted the office asking what the laws and the rules were that were broken, and they said to me at the time that they could not share that information with me because it had to go through a process, like a corrective action plan, that, you know, they had to go through the process if any disciplinary action was going to be taken, all of that. And so I was supposed to follow up. Well, if you all hear the dates that I just gave you, that was March of 2020, the very first week. You know, and I know that COVID happened right about that time, and life got a little strange. And I will take full responsibility for not following up before now. And I wish that I had, because had I done so, had I pushed and pushed and gotten my hands on the document that I got yesterday, there's a very strong possibility this family would have legal recourse. But I did not. I didn't know when the process was going to be done. I don't even know if I could have gotten my hands on it, but I didn't have it. And for that, I am deeply sorry. So the only thing that I can do now is to report to you the findings and why they matter. And I'm going to report to you what Ballad Health said about all of these instances, and I'm going to report to you what the facts are. So that was the end of it for then. Now, when I reported this about these sepsis-like conditions, Ballad Health was very public in saying that the information that I shared was misinformation, that it was inaccurate information. And they went on to release a public statement that said there were, here it is. They went on to release a statement to say that it says there was no indication anything was done wrong other than the timing of these outcomes being so close together. It says that after several days of intensive and clinical review, this is a public statement made by Lindy White. the CEO of Ballad Health's Northwest Market, and the CEO of Holston Valley Medical Center, and the CEO of Bristol Regional Medical Center. And she said in this statement, and I quote, "After several days of extensive and clinical review, laboratory testing, staffing reviews, and the evaluation of the environment of care, Ballad Health, along with state and federal experts, reached the unanimous conclusion that none of the small number of recent patient outcomes occurring in Holston Valley's cardiac program were the result of any infection or any systemic issue. In fact, all investigators agreed that these outcomes were not in any way clinically related and could find no causal factors that would lead anyone to believe the standard of care was not followed. The ultimate conclusion is that the outcomes were not outside the scope of what would be expected based on the severities of the patient's illnesses." It says patient records were reviewed extensively, and over several days, every aspect of care was reviewed. Well, now I want to tell you what I found. And I want to make this statement clear at the very beginning so that you know what I'm saying. I am in no way saying that Ballad Health caused the death of those patients. I am not saying that there was an infection that they caused in these patients. I am not saying that. Here's what I'm saying is that what they said to the public indicated that this was just something that occurred, and it happened to occur all at the same time. And there was nothing that they could find that all of these patients shared. Okay. So I sent a FOIA request to the Tennessee Department of Health. And first of all, let me just share this with you. They said that I reported misinformation. And what I reported was that it was a sepsis-like condition. What I would like to share with you is the Tennessee Department of Health's internal email, in which Ballad Health's Jamie Swift is copied on it. And it says, "Dr. Kirsch and Dr. Dunn, I wanted to start an email chain summarizing an evolving situation at Holston Valley Medical Center. I was contacted today by Jamie Swift of Ballad Health regarding a cluster of 3 patients who recently underwent cardiothoracic surgeries, CABG procedures, and subsequently developed a sepsis-like condition. 2 of the 3 patients have since died, and the 3rd is in critical condition. Jamie and her team are working quickly to create a line listing of all patients and are also ensuring that the OR where 2 or 3 of the patients received surgery is closed until further investigation can be performed." Now, what's important to note is all of these surgeries did not occur in the same OR. How do I know that? Because Danny Cook got this short line spreadsheet that they just referenced in that email. I want to show you, though, the spreadsheet that the Tennessee Department of Health sent to me. And then I'm going to share with you the spreadsheet that the CDC sent to me because I FOIA'd them just a couple of weeks ago. So bear with me one moment. Before I do that, because they like to say that I lie, I want to show you how I got the information. Whoops, that's not the one I want to show you yet. Give me one second. I have a lot of documents to share with you. This one should say open, 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 this one. So let me pick this up and show you. This is the open records request that I sent. Please find attached documents responsive to your open records request. And these are the attachments. You see this email that was opened up? All of this is in here. Okay. So that's the FOIA request that I sent. That's where I got these documents. So let me show you. The first document that I got, the spreadsheet that's attached, is from the Tennessee Department of Health. And I'm going to pause it while I pick up my phone and show you guys this part. So as you can see, it clearly says in this column right here, sepsis syndrome less than 24 hours post-op with respiratory distress. In the next column, you see that it says sepsis. And then up above here, there's another patient that also says, it also says sepsis. Where's the third one? It's on here 3 times. Sorry, guys. It takes me right here. So sepsis here, sepsis syndrome here. So when Danny Cook said to you that there was a sepsis-like condition that they developed, their internal emails said that, and so did their spreadsheet. Okay. The other thing that's important for you to see is this spreadsheet that I'm showing you is actually the one that the daggone CDC sent me. So hold on. I want to show you the one from the Tennessee Department of Health. Nope, that ain't it. Here's the last one. Okay, now I'm going to pause right here. So do you see this area right here that's all blacked out? This section was sent to me by the Tennessee Department of Health, and those 3 columns were blacked out so that I couldn't see what was there. Now, if you go and you open up a spreadsheet and you go to the properties of the spreadsheet, you can actually see who created the spreadsheet. You can see it was last saved by Paige Evans, that's of the Tennessee Department of Health, and that it was created by Nicole Reeser in Mountain States Health Alliance, which is Ballad Health. So I got sent this spreadsheet by the Department of Health, saved by Paige, whoever I just told you her name was, and they blocked out those 3 columns so that I could not see what was there. Now, when I FOIA'd the CDC, this right here, this is my FOIA request to the CDC. The CDC gave me that same spreadsheet. Do you see that? So now I'm going to show you what that spreadsheet says was in those 3 columns. So as you can see, I'm highlighting for you the sepsis that is on this sheet again. Sorry, I'm shaking, guys, but I have my phone in one hand and I'm broadcasting from the other. But here's the important part. Here are the 3 columns. All of the patients, when they left cardiac ICU, were in the same room. Every patient was in room 20L. One patient was in 20L on the February 4th and the 5th. One was in February 5th and the 5th, February 7th. One was in on February 13th, February 11th through the 13th, and February 14th. Those are the 3 columns that were blocked out on the spreadsheet sent to me by the Tennessee Department of Health. Now, I want to be clear once again. I am not saying that this is the cause of those patients' death, because I do not know that. What I am saying to you is that when Ballad Health said to the public that they reviewed all of these patients' documents, all of their environmental care, and there was nothing that stood out to them, there was nothing unusual except for the fact that they all died within the same time frame, I would beg to differ. I spoke with three medical experts in the last week, and I asked them, how significant is it to have all of your patients have been in the same room and then have a cluster of deaths in the following days? Every physician said to me that it was very significant. These physicians said to me what they would have done at that time would have been to investigate the HVAC system, to investigate the plumbing system, to look at the staff, if there was a particular dedicated staff coming in and out of that room. Like, it would have been very important to evaluate everything about that room, because you don't know what did or didn't occur. Now, I asked them, how significant would it be to exclude this in an investigation? And I was told it would be even more significant to exclude it. As significant as it is, you can't determine. So I, again, am not saying there was not a standard of care. I am not saying that they caused this death. I am not saying any of that. What I am saying is that the way that it was presented to the public was that there was nothing common or unusual about these patients, other than they all died within a week or so of each other. Matter of fact, what did Lindy White say? She said the ultimate conclusion is that the outcomes were not outside the scope of what would be expected based on the severity of the patient's illnesses. Patient records were reviewed extensively, and over several days, every aspect of care was reviewed. That's what she said. We're going to talk about this public statement that Lindy White put out again in just a minute. So when I FOIA'd these documents from the Tennessee Department of Health, a very unique, interesting thing occurred. I got 26 different attachments in the first set of emails with the subject line of the first email there, but all the other emails might be different. And when I was looking through this email that said the title of the email was, sorry, shit. Can I get to the right page? Sorry. The title of the email was, oh, I bet you that's how they got around it. So I need to resend another FOIA request. Actually, I did earlier today. Let me see what I get. Anyway, when there was an email that Alan Levine sent to Lisa PIERCEY, I'm now paying attention to the very, very details. So I'm going to send another one. The title changed. Yeah, the title changed. So the original title of the email was, the attachment that I got was referencing an important message from Lindy White. The title changed to, hold on. No, I'm lying. No, it didn't. No, it didn't. Thank you, God, that I got my shit together. So listen, sorry. So Lisa PIERCEY replied back to this email from Alan Levine, according to a screenshot that was taken by Valerie Noga-Shiner, the chief of staff. So let me share with you all what I got. So I'm going to give you a timeline of events. This investigation was ongoing from the 19th to the 20th to the 21st. Okay. And the summary did not come out until the 25th. How do I know that? Because I have a copy of it and I'm going to show it to you right now. So this is the summary. And the summary says that because the cardiovascular surgeries were canceled during the days that the Department of Health was on site, they were not able to observe an actual procedure. Nor were they able to observe instrument reprocessing from these procedures. They did meet with the members of the team, right, who attested that they closely monitored things, but there were things that they were not able to investigate. And so if you say, it says 3 members of the Department of Health visited the facility from the 21st to the 23rd. That's actually not correct because I have emails showing them there on the 20th, but I digress. It goes on to say that the medical evaluation for infections varied among each patient. So not all of the same things were looked at amongst everybody. But if you look, the date of this summary was the 25th. Do y'all see that? And it says the Department of Health was still there visiting on the 23rd. Well, why is that important? Well, it's important because on Sunday, the 23rd, is when Lindy White put out that statement about there having not been any causal factor, no systemic issue, and that these deaths, there was nothing outside the scope. Rachel, here's what I will tell you. So let me just say this. There were more than 3 deaths. At the end of this, there were at least 5 that I know of. A gentleman yesterday said he was informed that his father was the 6th. I do not know that to be for sure. And I can tell you that there were more than 1 surgeons involved and more than 1 CVOR room. What's important is that the email that I got So this email was sent, let me show you. Valerie Nogersteiner, the chief of staff, took a picture of this email and emailed it to herself. And it's from Lisa PIERCEY on that Sunday to Alan Levine saying, thank you for sharing this. I am so sorry y'all are having to go through the turmoil of inappropriately shared misinformation, but please rest assured that we are confident you guys handled this swiftly and appropriately. Now, I'm not sure how Lisa PIERCEY, the Commissioner of Health, drew this conclusion on Sunday when her team was still there and the summary had not been released, but she did. So when I saw this email, all I have is a picture of the email that Valerie Nogersteiner included in it, that came up in my FOIA request. So I FOIA'd the Tennessee Department of Health asking for that specific email. And I'm going to put them on the screen side by side, and I'm going to share with you the response that I got. There we go. And hold on, bear with me, folks. So let me show you. This is the screenshot that I got from Valerie Nogersteiner's email. And then this is the response I got from the Department of Health. The response that I got was, as attached. Look, so there's not an email dated Sunday, 23rd, 2020 from Lisa PIERCEY to Alan Levine with the subject reference an important message from Lindy White. That's what it says. There's not an email. However, I have a picture of the email that Valerie Nogersteiner took and sent to herself. Keep in mind, Valerie Nogersteiner is the chief of staff at the Tennessee Department of Health. So when I found out about this a week ago, I went live about it. And I said, the policy for the destruction and deletion of records is to keep them for 5 years. And it would appear, based on the response that I got, that somehow this email that Valerie Nogersteiner took a picture of no longer exists. There's no record of it. So somehow it's been deleted, it's been destroyed, it's been something based on that. Because the title, the date is the same. And the only thing that they returned to me was the email from Alan under that subject. So I reported on that last week and then again yesterday morning. And in my broadcast yesterday morning, I said, I don't know who governs these things. I don't know who would be reported to, but apparently this, a document has been destroyed. That's what it appears. Okay. So that was yesterday morning. I'm going to hit pause on that story right there. And then I want to bring you back to the summer of 2020. So in February 2020, we have these cluster of cardiac deaths where Ballad Health says inaccurate information was shared. And what I reported was exactly what they reported to the Department of Health, which is exactly what the Department of Health reported to the CDC. And fast forward to August of 2020. And the reason this is relevant to you is because Ballad Health is a medical monopoly. And they always talk about being transparent with the public. And if you remember, Ballad Health, I don't know that, but this is what I would say is that I don't know because I cannot see the email address. I cannot see the email address. And it says found in sent mailbox, and it's got her Tennessee Department of Health picture. So I do not know. I guess that would be a question for Valerie Nogersteiner. I don't, because I honestly don't have the answer to that question. But if you remember in August, on August the 20th of 2020, Ballad Health released a press statement regarding Bristol Regional Medical Center CEO at the time, Greg Neal. And this is what their original statement was. Their original statement was, Greg Neal, who has served as CEO of Bristol Regional Medical Center since 2013, has stepped down, according to a news release from Ballad Health. Dr. Chad Couch has been named interim CEO of Bristol Regional Medical Center effective immediately. The release states, Ballad said of Neal, quote, Greg is a strong and passionate leader who accomplished a great deal during his time at Bristol Regional Medical Center, and we are grateful for his years of service. Couch is currently the chief medical officer. He will serve as interim CEO while there is a search for a permanent CEO, according to the release. Now, that was on August the 20th. August 24th, I did a live broadcast and I broke the story that Greg Neal actually participated and made the initial incision into a patient's chest during cardiac surgery at Bristol Regional Medical Center. I gave that report on the 24th of August. So on the 20th, Ballad says, Greg is stepping down. He's a strong, passionate leader. He's done great things. On the 24th, Danny Cook does a live broadcast, says Dr. Nathan Smith had allowed Greg Neal to make the initial incision on a cardiac patient's chest. And on the 25th, this is the second headline. Neal asked to resign as Bristol Regional Medical CEO after participating in surgical procedure without a license. You can see that's on August the 25th, 2020. That headline is from the Bristol Herald Courier, as was that first story. So here's what I would say to you. When Ballad Health says, we are transparent with you. When Ballad Health says we take every patient seriously. When Ballad Health says we do our own investigations and we self-report and that we hold people accountable. What I am saying to you is that no, you do not. And I'm not saying that because I'm guessing. I'm saying it because you released a public statement. The family has done a lawsuit that is currently being litigated. Ballad Health. So Greg Neal was the CEO of Bristol Regional Medical Center. He scrubbed into a cardiac procedure, took a scalpel in his hand, and made the first incision into a patient's chest. Ballad Health did not report it to the public, nor did Ballad Health report it to any other agency. They did not self-report. They put out a public statement saying Greg's been a strong and passionate leader, right? Now, this was my report, my follow-up the next day. My follow-up says, story update. Today, Greg Neal admitted these events took place in a statement given to the Bristol Herald Courier. As reported in my live broadcast last night, sources alleged former Ballad Health Bristol Regional Medical Center CEO Greg Neal was forced to resign over a surgical incident. Multiple sources have alleged that Greg Neal, former Bristol Regional Medical CEO, was forced to resign last week over a surgical incident involving an open heart surgery. This is what I said. The alleged events are as followed. On August the 17th, 2020, Dr. Nathan Smith, new cardiac surgeon, invited Greg Neal to scrub in and observe an open heart surgery. A member of the anesthesia team witnessed Greg Neal make the initial incision into the chest of a patient. This team member reported the incident to management within 24 to 48 hours. The entire OR team was interviewed by risk management to ascertain the details of the event. On Friday, August 21st, actually it was the 20th, they said Greg is a strong and passionate leader. So these were my questions. Will Greg Neal be prosecuted for practicing medicine without a license, which is a Class B misdemeanor? Number 2, by cutting a patient's chest open with a scalpel, i.e. a knife, without the patient's permission, did Greg Neal commit assault? Number 3, if the act is considered assault, is it assault with a deadly weapon or aggravated assault and therefore a felony? Number 4, if in fact this is a felony event, is Dr. Nathan Smith, the surgeon, an accomplice to the event? Number 5, by forcing Greg Neal to resign with a rosy statement of his service, is it to be understood that Ballad Health was attempting to cover this event up? Number 6, if Ballad Health is understood to have attempted to cover up this event instead of immediately reporting it to the medical and legal authorities, did the corporation commit a crime of being an accomplice after the fact? Number 7, even if the incident is a misdemeanor and not a felony, is Ballad Health as a corporation still criminally responsible because the perpetrator was an officer / high managing official whose acts are legally regarded as acts of the corporation? That's what I asked on August the 25th, 2020. Now, fast forward to 4 weeks ago. 4 weeks ago, the attorneys for that patient filed amendment to their charges. These are not criminal charges brought by the DA. These are charges by the medical malpractice attorneys for the family, for the patient. And the charges were amended to include assault with a deadly weapon, which is exactly what I asked about. So when those charges were amended, right, it kind of lit my fire again. And then I was like, damn, I wonder whatever happened with that violation letter I received from the Tennessee Department of Health about those cluster deaths, right? And all I could remember at the time, because this 2 years ago, was that I filed the complaint about the cluster deaths. I had forgotten that I included additional information about other patients and other cases that I was aware of at the time. So 4 weeks ago, I began calling the Tennessee Department of Health licensure for healthcare facilities, both in Nashville and in Knoxville. And I left my name, I left the complaint number, and I left my phone number asking for an update on what transpired. Because surely 2 years later, they should have finished whatever process they had going on and be able to share that information with me. For a month, I received no call back from the Tennessee Department of Health licensure for healthcare facilities. Yesterday morning, I decided to give it one more shot. And I called, and some unlucky girl answered the phone. And when I called, God, I have so many documents in here, you guys, forgive me. When I called, let me just see if I have this in here for you. Let me see if I can upload this for you. Give me 1 second. I can't believe I'm going to try this in the middle of a broadcast, but I am. Because I think it's important for you to see it. I got it. Here we go. Hold tight for me. So this is the letter that I got April 16th, 2020 from the Department of Health. Here's what it says. The surveyor used, oops, let me show y'all. It says the surveyor used the specific concerns you relayed in your complaint to review compliance with regulations that most closely related to your concerns. The surveyor did find, sorry, y'all, that's going to have a glare on it. The surveyor did find that rules and laws were violated. You see that? So the surveyor did find that rules and laws were violated. So I was calling to find out about that. And yesterday when I called, here's what transpired. The girl that answered the phone, I gave her my name. She asked me for the complaint number. I gave that to her. She pulled the complaint up in the system. I heard her typing. And then she says to me, Danny, I'm going to have to ask you to hold on for a minute. So I did. She put me on hold for over 4 minutes. She came back to the phone and she said, Danny, are you still there? And I said, yes. And she said, sorry to keep you holding so long. I'm going to have to transfer you to my supervisor. And I said, okay, no problem. She transfers me to the program manager. And the only reason I know that is because her name is on the letter that I got. So I'm talking to her and I tell her who I am. I give her the complaint number. I tell her that I'm following up on this complaint that I filed, and that I want to know what was the outcome of this investigation. If they found that the facility had violated rules and laws, I would like to know what laws were violated and what was the outcome, what action was taken. The person at the Department of Health tells me that while she can look that information up into the system, she cannot tell me. She tells me that they did a statement of deficiencies that I should be able to find online. I tell her that I have looked repeatedly and I cannot find it anywhere online. And I would like to get a copy of the statement of deficiencies because that is supposed to be public record. She tells me that if I want a copy of the statement of deficiencies, that I need to email May Copeland. So I take down May's email address and I say, okay. And I said, well, listen, I have a couple of other questions because I'm not familiar with your process. If you all find rules and laws are violated, what do you do next? What happens next? And she says, well, it depends. They normally put together like a plan of correction, and depending upon the outcome of that, then, they take different actions. And I said, okay. And I said, well, when I was on your website yesterday and I looked up the hospital, it says in blueprint, no disciplinary actions. And I said, is it standard practice for you to find that a facility has violated rules and laws and for no disciplinary action to be taken? And she said, stay with me, guys. And she said, well, that depends on what the laws were that were violated. And I said, okay, well, can you tell me who normally makes that decision? Who determines if disciplinary action is taken once an investigation is complete and you find out that laws have been broken? And she said, on the state level, it's either the Board of Healthcare Facilities or the Commissioner of Health. And I said, well, how do we find out which of those two made the decision not to take disciplinary action in this case? And she said to me, that information is not available to the public. So I'm not allowed to know, and you're not allowed to know, whether it was the Board of Healthcare Facilities or whether it was the Commissioner of Health that said, we're not taking any disciplinary action, even though laws were violated. Now, keep in mind, at this time, I don't even know what the report is because I haven't seen it. So I say, then she says to me, but the Board of Healthcare Facilities meetings are public record and their minutes are online. So if you go and read their minutes, you should be able to see if they ever made a decision regarding this particular complaint. So folks, between yesterday and today, I personally reviewed all of the minutes from the Tennessee Board of Healthcare Facilities since October of 2019 through February of 2020. And here's what I will tell you. The Board of Healthcare Facilities meeting minutes did not include Ballad Health or Holston Valley Medical Center, except for on 3 occasions. The first occasion was on June 3rd, 2020. And that is when they were granted, just like all the other trauma centers in the state, they were granted an extension on their trauma certification because of COVID. So instead of having their renewal done in May of 2020, it was granted that they got an extension until May of 2021. And that was in those meeting notes. After that, no other mention of Ballad Health or Holston Valley Medical Center until October of 2021. And in the October of 2021 notes, this one surprised me. The trauma designation for Johnson City Medical Center, Bristol Regional Medical Center, and Holston Valley Medical Center were all changed to a provisional status to be reviewed within 1 year. So what that means is, prior to this, Johnson City Medical Center had a trauma designation as a level 1, period. Holston Valley had a trauma designation as a level 3, period. Bristol Regional had a trauma designation as a level 2, period. Their trauma designations were changed to a provisional status, and it was deemed that it would be reviewed within 1 year. So what does a provisional status mean? A provisional status means that you have substantially met the requirements of that designation, but not fully. So it appears what this may indicate is that all 3 of Ballad Health's trauma centers did not fully meet the requirements for their designations at the time that they were visited in 2021, and that they were given a provisional status to be revisited in 1 year, is what it looks like and may mean, because they went from a full status to a provisional status. And provisional means that you have substantially met the requirements, not fully met them. The third time that Holston Valley Medical Center and Ballad Health is included in the healthcare facility notes, board meeting notes, is in February of this year, when they asked to do their hospitals at home program. So by deductive reasoning, if the only 2 people, if the only 2 bodies that can say whether or not to take disciplinary action is either the Board of Healthcare Facilities or the commissioner, and nowhere in the Board of Healthcare Facilities minutes does it say anything about this, one could deduce that it was Commissioner PIERCEY who decided not to take any disciplinary action, even though laws were violated. I cannot say that with 100% certainty, but what I can say is that if it's only one of those 2, all of the public minutes of the meetings for the Board of Healthcare Facilities do not address this disciplinary action. Now, yesterday afternoon, I sent an email around lunchtime, around noonish, to May Copeland of the Tennessee Department of Health, requesting the statement of deficiencies regarding the violation letter that I received. Okay. I got no response from her, 0 response from her. So I started digging, looking for the regional office in Atlanta for CMS, the Centers for Medicaid and Medicare. And I found a number. I called that individual. I left a message and I said, I don't know if you're the person that I need, but I need some help. I'm trying to get in touch with the person at the Centers for Medicaid and Medicare that would have a statement of deficiencies for a hospital following a complaint. About an hour or so later, I got a phone call back from the person who handles those at the Centers for Medicaid and Medicare in Atlanta. Atlanta is the regional office that covers Tennessee. They also cover, I believe, North Carolina and Georgia. And this person said to me that he said, oh, you're looking for a 2567. Not a problem. I give those out all the time. They're public record. Let me just double check. I'll see if I got it. I'll double check. And if you can shoot me an email, here's my email address. Let me know that you want a copy of it. And if I have it, I'll give it back to you. I said, cool. So I get a phone call back about 30 minutes later. And the individual says to me, Miss Danny, I found your 2567. That's the CMS term for a statement of deficiencies. And he says it's 25 pages long. And this is where my world got turned upside down yesterday, folks. He sent the statement of deficiencies to me. I'm holding it in my hands. And I began to read it. Now, before I tell you what is in the statement of deficiencies, I want to go back and read to you what Lindy White told you, what Lindy White said to the public about how Ballad Health does its internal investigations and self-reports. Are you ready? This is the statement that Lindy White put out on Ballad Health's website and sent to the Kingsport Visionary Board after the cluster of cardiac deaths. This is what she said. Well, first, I'm going to tell you what Lindy White said, and then I'm going to tell you what Alan Levine said when he forwarded Lindy's statement to the Commissioner of Health. So Lindy White said, sorry, it's a lot. 7, 8, 9, 10. Here we go. She said, being a top performing hospital means we take each case very seriously. When we lose a patient, our physicians undertake, in partnership with the hospital, a review of any patient death. And she put any in all caps. Can y'all see that? Any in all caps. And it says a review of any patient death, even seeking at times outside review by additional experts to ensure. Sissy, Tutu's doing something important. Can you turn that down? Sorry, I'm on Tutu duty. And she has serious bedhead, right? When we lose a patient, our physicians undertake, in partnership with the hospital, a review of any patient death, even seeking at times outside review by additional experts to ensure we learn everything we can or to validate that all the proper steps were taken to help the patients. This is a best practice and is standard in any hospital seeking continuous quality. The laws of our state and our accreditation standards are constructed to encourage this very type of review, and the confidentiality of such review is protected by law to encourage voluntary and engaged participation by doctors, staff, and any participant in the care of the patient. If there are findings that the standard of care is not followed, there are self-reporting requirements to regulatory and accreditation agencies, which ultimately result in plans of correction being required. If physicians or nurses are found to be out of compliance with standards, there are licensure implications for them. So this is a very serious process, and one which Holston Valley and Ballad Health take very seriously. It is designed to protect our patients. That is what she said to the public on February the 23rd, 2020. Alan Levine said in his email to the Kingsport Visionary Committee that he forwarded to Commissioner Lisa PIERCEY, this is what he said. Number 5, this entire process is protected legally from public disclosure until an investigation occurs and the following happens. If there is a quality of care problem because the standard of care is not met, or if HVMC, Holston Valley Medical Center, may have violated its licensure requirements or accreditation standards, then HVMC is required to self-report this to its accreditation agency, the Joint Commission, and to its state regulatory agency, the Tennessee Department of Health. In such a case, either or both would conduct their own investigation, and if the hospital is found to have violated licensure standards or its accreditation standards, then either or both agencies will issue statements of deficiencies. Upon receipt of the statement of deficiency, the hospital would then be required to submit a plan of correction. At that time, the statement of oh, that's interesting. Okay. That comment says, I know for a fact that all hospital deaths were not reviewed by a specific physician group in the hospital. Good to note. It says, at that time, the statement of deficiency and plan of correction are made public. If the matter is so severe that patient harm could be imminent, the state and Medicare program would put the hospital in immediate jeopardy status and could stop the hospital from admitting patients or doing surgery. So by Alan Levine and Lindy White's own words, if there was a deficiency, which we know that there was, they would have been legally required to self-report, and they would have been legally required to do an internal investigation and all of these things. And they told you they take this very seriously. They told the public, this is what we do, and we take it seriously to protect our patients. And they lied to you. And I can say that definitively because I have proof. I got my hands on the statement of deficiency for the violation letter that was sent to me. And let me tell you what happened. There were 5 laws violated. 5. And I'm going to share with you some specific information that is difficult, very difficult to read, because I personally sat outside Holston Valley Medical Center under canopies and tarps, peacefully protesting to save this trauma center. And I listened to this family cry, and I listened to audio of this man say, God help me, they're going to kill me, I'm going to die. And he did. My complaint number, if you remember on that letter, was TN 000-50499. This says investigation of, whoops, let me get it on here, right? Investigation of 00, see right here, it says 50499. So this is about the complaint that I filed. They were, in fact, put on an immediate jeopardy. This incident happened in the fall of 2019. This investigator was there the first week of March 3rd through the 10th of 2020. So just 10 days after Lindy White sent this very public statement about their self-investigation and their self-reporting requirements, she had to answer to an investigator about why a case wasn't reported, why it was not taken care of. So here we go. The very first violation is violation A084. And it's under contracted services, CFRS 482.12E1. And this is the requirement. It says the governing body must ensure that the services performed under a contract are provided in a safe and effective manner. Now, the reason why that's relevant is because the patient that attended to, the doctor that attended to this patient was what's called a locum. They were a locum trauma physician. So if you remember, and maybe you are not aware, leading up to the downgrade of Holston Valley Medical Center's Level 1 Trauma Center, Dr. Tiffany Lasky and Dr. John Keeley left the program. We lost 2 phenomenal trauma surgeons because they were downgrading Holston Valley Medical Center. When they downgraded Holston Valley Medical Center, it put 87,147 people outside the golden hour, that extremely first important 1 hour of care. And these physicians said this is detrimental. This will have serious repercussions, things of that nature. You may have heard me tell this story of when the protests first started and we were outside of Holston Valley Medical Center, and I'm standing there in the grass and someone taps me on my shoulder and I turn around and it's this lady in scrubs, very unassuming, brown hair. And she says, I wanted to come outside and personally tell you thank you. And I said, oh, you're welcome. And she said, you don't know who I am, do you? And I said, I do not. And she said, I'm Dr. Tiffany Lasky. And she hugged my neck, and this trauma surgeon cried until her shoulders shook on me that day. I will never forget that moment with her, ever. So we had a locum trauma physician, which means a temporary contracted trauma surgeon, trauma physician. And that is why this requirement, this law is important, because Ballad is required. They must ensure that the services provided under a contract are provided in a safe and effective manner. And what it says is this standard, and the standard is in all caps because there's a difference between a standard and a condition. So it says this standard of care is not met as evidenced by, and it goes on to tell me a couple of things, but I'm going to give you the paragraph before I share some details with you. It says, based on medical record review and interview, the facility failed to ensure contracted medical staff assessed a patient with a change in condition for one patient of 4 patients reviewed for a change in condition, resulting in patient 1's continued decline and subsequent respiratory and cardiac arrest. And then it goes on to tell you the findings include. I'm not going to go into some of these details, but I do want to tell you what was said when this trauma surgeon, this locum surgeon, was interviewed about the patient. Wait a minute. So I'm going to share with you that the nurse that was taking care of this patient was a new graduate. That is documented in this. The nurse that was taking care of this patient was a new graduate. This report says that, hold on, because there's a couple of them right here. New graduate RN was hesitant to ask for assistance. There was no provider/residents in-house. There was no in-house physician in this ICU unit. It was the MICU unit. So you have a new graduate, a new RN, taking care of this patient with no in-house physician. In addition to that, the charge nurse had a staffing assignment. So the charge nurse had a patient of her own in critical condition to care for. And then it says the locum was not readily available. The RN did not ask a medical doctor to assess the patient in person. The RN failed to manually check the blood pressure, and I'm going to share with you why that's important in a moment. Duplicate X-ray orders were done in 2 charts at the same time, which resulted in a radiology technician canceling one order that also canceled the second order. This patient came in after a severe motor vehicle accident with what's called a flail chest, where you have multiple ribs that have detached from the chest wall. It's excruciating pain. It's a very serious injury. It is, in fact, a level 1 trauma. So one may ask, why was this patient taken to Holston Valley Medical Center instead of Johnson City Medical Center, which was now level 1? And Holston Valley had been downgraded on October 1st. I don't know the answer. You may also ask, why wasn't this patient transferred to Johnson City Medical Center? I do not know the answer to that. What I can tell you is that the physician saw the patient the morning after the accident when he did morning rounds, and he did not lay his eyes on this patient again until the next morning when the patient was coding and subsequently died. The physician did not come in to assess this patient when he was contacted and told about the patient's continual lowering blood pressure. So the patient's blood pressure continued to drop. And I'll tell you two things about this patient that are important. One, he was obese. Two, he had had opioid addiction in the past and was on methadone treatment at home, so recovering on a program. When the nurse contacted, nope, that's not the one I want. Here it is. When the investigator interviewed the nurse said, and I quote, that the physician said, "I am not really concerned with low blood pressure. He's been high all day." The nurse also told the investigator that the physician said, the physician gave him a verbal order instead of coming in to see the patient in person. The physician gave him a verbal order and told him to give the patient Ativan. Within minutes after the Ativan was administered, the patient's eyes dilated and they called a code blue. I'm going to stop there because there's some things that you need to know before that. When the investigator interviewed the physician said, "Hold on, I'm coming." Sorry, there's too many things around this. That's the RN. Is it over here? Sorry. Yeah, they were giving him Ativan because they said he was anxious. Here we go. There's a second quote that is important from the physician. The physician said to the investigator, and I'm trying to find it because I want to say it exactly correctly, so stay with me. This is the part that's important. Because I want you to remember while I'm reading this to you that this is the statement of deficiencies. This is the report that I tried to get from the Tennessee Department of Health and had to get from CMS. This is the report that they would not tell me whether it was the Board of Healthcare Facilities or the Commissioner of Health that decided not to take disciplinary action against the facility or against the physician. So let me tell you what the physician said. And guys, I don't want to try to diagnose this patient or talk about whatever. I want you to hear what was actually said and what was discovered in the investigation. So when here it is. In a telephone interview with the physician on March the 6th of 2020, the physician stated, "I got a call around 5 a.m. This is the morning of the death, from the nurse who said the patient had intermittent mild hypotension when he was agitated, did not know that it was severe hypotension. He said the first page I got was 5 a.m. when his systolic BP was in the 70s. That is not normal. The first thing you do is see the patient, blah, 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 whatever." Then I'm just going to pull it up on the computer because I can access it quicker this way. 1 second. Boom. Here we go. So, this is just the way I had to do it. It says, during this telephone interview, the doctor said, the physician stated, and I'm quoting now, I put him, patient number 1, in the ICU, aggressive pulmonary toilet. The next day, I saw him rounded with a mid-level nurse practitioner. He was doing fine, sleeping, resting comfortably, which is not what the nurse says. The nurse says that the patient was thrashing and sweating through his sheets. But anyway, he says, got a call around 5 a.m. from the nurse who said that the patient had intermittent mild hypotension, did not know that it was severe hypotension. Don't remember the nurse saying that the patient was hypoxic. But by the time I got there, this is after the code. By the time I got there, he was coding. Hemothorax was associated with rib fractures. The blood associated with his rib fractures didn't require any intervention. It is not typical, and it is not our practice to do routine x-rays. We're going to come back to that in a second. And then he says, this is the physician. He says, if I had $1 for every narcotic abusing patient who complained of breathing issues after chest trauma, I would not work anymore. Those two statements by this physician are clearly discriminatory and prejudicial. Clearly. I want to tell you that the code for this patient occurred at 5:32 a.m. Prior to that code, I want to tell you about this patient's blood pressure levels. At 12 a.m., the patient's blood pressure was 139/78. At 1 a.m., his blood pressure was 116/76. Jen, I'm sorry, baby, to be reading this part. Sorry, I'm so sorry that you guys are watching this. At 2 a.m., the blood pressure was 104/77. At 2:15 a.m., the blood pressure was 74/47. At 2:30 a.m., the blood pressure was 76/50. At 4 a.m., the blood pressure was 86/42. At 4:15 a.m., the blood pressure was 73/29. At 4:30 a.m., this patient's blood pressure was 54/12. At 4:45 a.m., the patient's blood pressure was 68/52. At 5 a.m., it was 80/40. At 5:15, it was 81/38. The patient was he laid there dying all night. A stat chest x-ray was ordered for this patient the next morning after his accident, and he was in there. That x-ray order was canceled, acknowledged as him being canceled by the nurse. The physician was never notified. The physician never asked for the chest x-ray. So I want to share with you the end of this. And then I'm going to come back and tell you why Lindy White matters, why risk management matters, why this public statement about their regulated, required self-reporting is bullshit, because they didn't do it. They didn't do it. This is important for you. This is important for you. And now let me get to these last couple of pages. It's 25 pages. Okay, so the medical record, well, first, there's a part that I want to read to you. Bear with me, folks. This is it. They did an interview with the chief medical officer on March the 4th of 2020. I'm sorry, you folks over here. I'm not looking at you anymore because I've got too many things going on. I'm sorry. The chief medical officer told the investigator, quote, the discomfort of a relatively new nurse to escalate uncertainty about how a patient is doing, compounded by unfamiliarity with the physician because the physician was a locum. The order, a routine chest x-ray, wasn't done ultimately because if 2 orders are put in and one gets discontinued, both get dropped. The care team not looking at the x-ray and wanting to know what it showed is something completely different. It's a standard for trauma, standard for chest trauma. That was a fundamental, and I'm reading to you the chief medical officer's words. That was a fundamental failure of basic trauma care of a patient with a major chest injury. The whole next day of follow-up wasn't attended to. It should have been top of their mind. Then the patient got worse. X-ray was done during the resuscitation, and he had a chest full of blood. Opportunities were missed along the way, is what he said. His code went from 5:32 to 7:05. It was an hour and a half long. I want to tell you the why it matters. Lindy White was interviewed by this investigator, as was the CNO, as was the chief medical officer, as was the director of risk management. And here's what I will tell you. The investigator did a review of an undated facility investigation. Now it's undated, so no one knows when this facility investigation, this self-internal investigation was done because it wasn't dated. And here's what the undated facility investigation says. The new graduate was hesitant to ask for assistance. I read this part to you already, but I'm going to just review it one more time. The new graduate, RN, hesitant to ask for assistance with no provider / residents in-house, no physician in-house. The charge nurse was in staffing, had a patient assignment. The locum, the contracted physician, was not readily available. The RN did not ask the doctor to come assess the patient in person. The RN did not manually check for blood pressure. The duplicate x-ray orders were canceled. And then there was an undated facility plan of correction that we also don't know when that was done. What we do know is that whenever they were done, Ballad didn't self-report, or this investigator wouldn't be there because I reported, right? So their undated plan of correction said the charge nurse, that the correction plan included the charge nurse not being included in staffing, education to radiology technicians to never cancel orders without calling the physician first, to educate new graduate nurses to call the physician with any changes in the patient condition and follow the chain of command, and to educate the staff in the MICU, the medical ICU, to follow the chain of command. Now, that's what happened. A medical review of the nurse's note showed that at 4 a.m., remember those blood pressure changes I told you about? At 4 a.m., which was an hour and 45 minutes after the first blood pressure reading was dropping, there was a call to the doctor, but there was no documentation as to what the nature of the call was. A second nurse called the physician at 4:52 a.m., but no documentation to specify the nature of the call. At 5:19, is when there was an order, a telephone order for the Ativan. It was given at 5:24, 5 minutes later. At 5:32 a.m. is when the code blue was started. It says that they called for the physician, but he had to, quote, travel in. So I don't know what travel in means or where that's from, right? Or how long it means. I do know that the code lasted an hour and a half. I want to tell you what Lindy White said to the investigator as we wrap up and I bring Kate on. So that's case management, that's the chief medical officer. Sorry, you guys, I gotta find it because I've got 25 pages right here. It's this group. Sorry, you guys. Here it is. During an interview on March the 10th, 2020 with the CEO at 1 p.m., the report says the chief executive officer, CEO of Holston Valley Medical Center, which would be Lindy White, stated that there was not a written plan for the implementation excluding ICU charge nurses from staffing. So remember, they had this undated plan of correction, which included not having charge nurses having a staffing assignment. So on March 10th, Lindy White says there was actually no written plan on how to implement that. She went on to say the facility was not monitoring how often the charge nurses were assigned patient care. The CEO was unable to show documentation for monitoring the effectiveness of the facility's plan of correction. They remained out of compliance for that reason. This statement of deficiencies, the Tennessee Department of Health, whether that's the Board of Healthcare Facilities or the commissioner, determined was not worthy of disciplinary action being taken. Not against the locum, which Ballad severed ties with the locum according to this report, but not against the healthcare facility, not against anybody, no disciplinary action. And this man is deceased. I spoke with a physician very familiar with Holston Valley Medical Center and its procedures for care. And I asked this physician this specific question. I said, in your expert opinion, because this person would definitely be considered that, did the downgrading of Holston Valley Medical Center's Level 1 Trauma Center contribute to the conditions and the experience that caused the series of events prior to this patient's death? And that physician responded to me with 2 words: yes, absolutely. It matters that Lindy White and Ballad Health put out a statement on February 23rd telling you how sacred the process of investigation is. It matters that they told you that they are required to self-report and they would absolutely do it, and that standard of care is everything for them. It matters that they told you that, and then 10 damn days later had to admit to an investigator that they had undated investigations, undated plans of corrections, and that they had never implemented anything in the plan of correction. And it matters that the Commissioner of Health and the Department of Health did not take any disciplinary action when this patient died. It matters. And it matters that politicians gave us a healthcare monopoly. It matters that Rusty Crowe, Gary Hicks, Bud Holsey, John Lundberg advocated for something you knew absolutely nothing about. You ignored the experts, not only from the FTC, but independent investigators. Robert Town, right? Kenneth Pfizer. You ignored experts who said a medical monopoly is horrible. You ignored the leading trauma surgeon in the state when he said there is no way that one trauma center can handle all of the level 1 traumas in the region. You ignored him when he said that to you. And you promised the people of this region that downgrading Holston Valley would not impact the care of its patients. And David Hawk as well. Thank you for adding him in there. It matters that you weren't going to tell the public what Greg Neal did until I reported it on the 24th of August. It matters that your first statement to the public about Greg Neal was that he was a strong, passionate leader who did great things. And you only told the truth after I broke the story on the 24th and the local media called you. It matters that you told the public there was no commonality in this cluster of cardiac deaths, and yet all the patients were in the same room after they left ICU. It matters that you said you are this epitome of the standard of care and how valuable your patients are, but you damn lied. It matters that there's legislation that makes it so difficult for you to get your hands on this information as the public. It matters that Tennessee has a 1-year statute of limitations for medical malpractice, so none of these families have legal recourse. It matters. North Carolina's is 3 years. Virginia's is 2 years. Georgia's is 2 years. Why is Tennessee's 1 year? It matters that you called me a liar and said I inaccurately reported things and I spread misinformation when you knew all along the truth. Here's what I'm asking you all to do tonight. As I bring Kate Craig up to the stage, you might say, Danny, why are you bringing an aspiring politician up? I'm going to tell you why. Because we're stuck with this bullshit until we vote other people in that can change things. That's why. Politicians, we would not have this medical monopoly if it weren't for the politicians that were used as puppets. We wouldn't. They would not have the privacy protections that they do had they not created the amendments and the laws that made it so. So I'm asking you all to do a couple of different things. Oh, thank you for that little piece that was in there. I have another special broadcast that is going to come up probably Tuesday because I need time to recuperate. But if you want to know how much money Ballad got because of COVID, if you want to know how they're screaming broke and it ain't really true, tune in Tuesday night at 8 p.m. for that broadcast, because I'm going to tell you exactly how much money it is and which facilities got it on top of those bonuses we talked about last time. What I need for you all to do for me, as Kate joins me, is I need for you all, I don't need you to do this. I'm lying, right? I don't need you to do this. What I'm going to ask you to do is I'm going to ask you that if you have experienced things like this, standards of care like this, that I'm going to ask you to report them to the Centers for Medicaid and Medicare. I'm going to ask you to contact the FTC and provide that information for their empirical study. I'm going to ask you to do more than just watch this broadcast. I'm going to ask you to do those things because you need them And it's the only chance we've got. It really, truly is. I put you guys up here and I got to turn around and take you right the hell back down because you can't see Kate if I don't show her to you. So hold on a second. Jesus. Oh, I used to have a ballad complaint form and I still do. Let me share that with you. This is the website for the Ballad Health complaint form that I put up. It's at thisisdanny.com/share-your-story. I would encourage you to take advantage of that. Very briefly, Kate, I know you've been with me for a while tonight and you stuck with me through a very long broadcast. But after what happened yesterday, which, by the way, I got that statement of deficiency yesterday afternoon from the Centers of Medicaid and Medicare, right? This morning, the supervisor who was out yesterday at CMS did not know that I'd already gotten the statement of deficiencies. And that supervisor sent an email to May Copeland at the Tennessee Department of Health and copied me on it and said, Ms. Cook, in the future, you can get these types of requests from your state agency. And I replied back and said, well, I've been trying to get that several times for the last month. I was unable to do so. So that's why I contacted your office. Thank you for your assistance, right? And then the person who actually fulfilled the request replied all and said, hey, I already filled this request for Miss Danny. You can close it. May Copeland replied and said, thank you for your quick response, letting us know. So that means that as of 8:30 this morning, the Tennessee Department of Health knew that I had the report that I just shared with you. And at 2:00 this afternoon, it was reported that the Tennessee Department of Health commissioner resigned. She is stepping down effective May 31st. Now, I cannot tell you that those things are related because maybe they are not. What I do think is that it's interesting timing that at the same time I find this email between her and Alan, and at the same time I'm being told no such email exists. And at the same time, I'm asking who's responsible for no disciplinary action on this case. And hours after they find out I have the damn statement of deficiencies, she's stepping down, effective May 31st. Don't know. So Kate, I want to ask a couple of questions. I know a little bit about you. I will say this, not a whole lot, but a little bit. What I do know is that you appear to have a stellar heart for the people and you want to change things. And share with people a little bit about why you're running for state senator to replace Rusty Crowe, and what you hope to accomplish when you get in office.
Sure. Well, first, let me say thank you for this opportunity to be here. And it would be a miss to not thank you for all of the hard work that you've put in for all these years to bring light to this situation, to help bring the community in. And so just from the bottom of my heart, thank you, because I've been a patient about Ballad Health and I have friends and family who have as well. So thank you. I also want to thank everyone for tuning in, for caring so much about our community, because I mean, that's why we're here. We care about this. And some of you know me, some of you don't, but I grew up here in Johnson City, and this is home. This is where I'm from. And I, as Danny said, I care very deeply about the people here. And, I think that we all have a responsibility to care for one another. And I've been a community organizer here since 2016. Technically, I started in college, but really since 2016. And I've recruited candidates. I've helped train candidates. I've talked, on issues and done issue advocacy. And coming onto this year and seeing that once again, nobody was challenging Rusty Crowe. And when the court paused everything and extended the filing deadline, I was just so tired of that happening, and so tired of having no accountability, and so tired of so many things, including the lack of Medicaid expansion, given he's the chair of the Health and Welfare Committee, that we haven't had a wage increase. The minimum wage hasn't been increased since 2009. Housing prices are skyrocketing, and yet wages have remained stagnant. That is just getting harder and harder and harder to live here. And so I just decided that, we've got to do something about this. And while I've been recruiting candidates, that I should step up and do the same and want to serve. So I went and filed papers, and that's why I decided to run. I tell everybody I think politics is about people. And so I think we talk about politics all the time when we talk about healthcare, when we talk about putting up a GoFundMe page to be able to afford it, when we talk about affording education or getting our kids to a good school, finding a job, all of that's politics. And so I want to see a thriving community. I want for neighbors and friends to be able to have good jobs and not worry when they go when an emergency happens, that they're worried on recovery. They're not worried about that bill that's coming. Their house doesn't have a lien against it from a hospital institution.
Right.
And all of these things are things that have happened.
Yeah. If you remember the reports, in the first year that Ballad Health existed as a healthcare system, they sued over 6,700 patients in their first year. It is no secret that they are ruthless when it comes to collecting their money. And I think the thing that is so dangerous is that, so for example, you said nobody's challenging Rusty. So when people say, well, of course, Danny, you put a Democrat up there. Well, let me just say this. There's not a single one of you damn Republicans willing to run against Rusty. You have your good old boys club. I literally spoke to another Republican who told me he wouldn't run against Bud Halsey. And so until Bud determined he didn't want to run anymore. So if Republicans won't challenge their own people in office, right, then you should vote Democrat. Now, let me just say this. In addition to that, not to make it about parties, right? But the reality is if you live in Northeast Tennessee, you need Medicaid expansion. It's just that damn simple, y'all. The only states having trouble with the Affordable Care Act are the states that didn't take Medicaid expansion, didn't take the money from the federal government. Those are facts. Those are the facts. Here's all I know. Gary Hicks, David Hawk, Rusty Crowe, John Lundberg, Bud Halsey, they gave you a medical monopoly. And if after watching this entire broadcast tonight, you don't have enough evidence to vote their asses out of office, quite frankly, you might deserve what you get if you keep them. What I am not saying, just do whatever Danny says and vote for Kate. What I'm saying is meet her, talk to her, read her website, find out about the issues, find out about her stances, talk to other people, like do your due diligence as a voter, become informed. And if you believe that she would do those things to bring about change in the region, to do something to help this medical monopoly situation that we have, which, by the way, folks, you and I know that things can be done. So if they change the law to give us a medical monopoly, maybe we could change the laws to change the way it's structured and how it exists, right? Maybe that's a possibility. Let me tell you this very quickly, because somebody said nurses union. I'm going to say this to you. There are over 260 of you who signed up and told me you wanted a nurses union. If that is still true, get with me. If that is still true, get with me. Kate, let me ask you this. Are you on the payroll of any healthcare organization or corporation in the region that you would be pushing legislation for?
I'm employed by Inside Alliance, which is basically the Washington County Anti-Drug Coalition to address substance use disorder in Northeast Tennessee. It is under a Tennessee Department of Health grant, but that is the work that I do through a nonprofit in Johnson City.
Gotcha. So what do you think about the fact that Rusty introduced this legislation while on Ballad Health and Mountain States Health Alliance payroll?
I think it's pay for play. I think that it's criminal. I think that he did it for his own profits and to help others. And it's exactly the reason why people hate politics. So I think that that's abhorrent. I think at the least should have abstained from voting, let alone not created this legislation to start with. But he did it to line his own pockets, and that's not what we need politicians of any party in there doing.
Right. I'm going to ask you a question that you and I have never talked about. So here we go. There is Tennessee legislation around hospital authorities. Okay. And one of the things that during the protest, when we were looking at potential solutions, the current legislation was introduced specifically to fit the needs of Chattanooga. And so in order to have a hospital authority, it requires that the city for it to be a city of like a population of 200,000 people. What I always said and what I proposed was if that legislation were to be amended, and if it were amended to say that the population of the affected community, right, the service region was over 200,000, which that would definitely be true for all the counties in which Ballad Health covers, right, then a hospital authority could then exist. Because then what would happen is there's already a board in Southwest Virginia. Tennessee could create one. They could come together and then they could ask. They can't demand Ballad Health to turn over their governorship, their board of directors. They can't demand that because they're a private corporation. However, I contend they're a private corporation that exists solely at the pleasure of the government under a COPA. And if the Department of Health said, hey, it's the public's better advantage if you are overseen by a hospital authority, not saying that you would pass or make it happen because you can't guarantee that, but would a potential solution or solutions similar to that be something you would be willing to explore with people and putting into the region?
100%. Absolutely. Addressing this issue is my number one priority because I think that this is something that touches every single person in this district in Northeast Tennessee and Southwest Virginia. I think that this touches every single family. And so finding ways to bring accountability and to unravel this mess that we're in is number one.
Second question, follow up. So before I came to Nashville in January of 2019, and I met with all the legislators except for Rusty Crowe, John Lundberg, and Bud Holsey. Bud was invited, but he did not come. I was asked by Representative John Crawford. He said, do you think that you could rewrite SB 2048 in a way that would provide protection for the business parts of Ballad, but that would also give the public transparency that they should have into complaints and whatever. And I said, I've never written a bill before, but I'll give it a shot. So I did. And I emailed it to John before I went up there. And I presented it to all the guys. None of them would sponsor it. They said that even if they did sponsor it, they didn't think that Crowe or Lundberg would carry it to the Senate. So here's my question. If I give you that bill, would that be something that you would be open to looking at, to introducing, to taking forward if it meets all the requirements in order to take some of this veiled protection that Ballad Health has away and make things more transparent to the public?
Absolutely. I understand that businesses need to have proprietary information. At the same point, we've got to have public accountability, and you can't cut the public out of that, especially when, as everything you've discussed in this broadcast, it should not be this hard to get information and to hold them accountable. So absolutely, it would be something that I would look at, consider, move forward, all of the above of all the different levels that you asked.
All right. So I know this was like a short snippet, right? But let me just tell you this. I am excited at the possibility of change for the region, especially when it comes to healthcare. I believe that the people in the region deserve access to quality, safe healthcare that isn't dominated by politics and business people. I believe that they deserve public servants and not politicians. I'm excited to see you as a candidate. I'm excited. I would love to see Blair Walsingham run again. there are other people that I would love to see step up and move this thing forward. So thank you for putting yourself out there. I know what it is to have a target sign on your back. And I know that running for office puts one of those there. So I appreciate you for being in the spotlight, for stepping up, for doing what's necessary to try to bring about change. I appreciate for you sitting here with me for 2 damn hours for like 15 minutes to talk to people. But I believe that it's important. Before we get off of here, if I would like to invite any of you that are watching to please put in the comments if you have any questions for Kate before we get off of here. Any questions whatsoever. It does not have to be healthcare related, but any questions. There's a couple. Kate has my vote. She has my vote. I'm excited to have a dang choice this time. I'd vote for Kate Craig if I lived in Tennessee still.
You can still donate.
You can still absolutely donate to her campaign. Absolutely, you can do that. Any questions for Kate at all, pop them in here and let me know. You can campaign, you can volunteer, you can contribute to the campaign, you can do all of those things. The bottom line is this. We got here because how would Southwest Virginia tie into this? Great. Let me answer that question for you, Candace. Southwest Virginia, in order to create Ballad Health, thanks to Terry Kilgore, you guys already have a hospital authority. So the same way the Tennessee Department of Health work together on the Virginia and Tennessee side, you would be able to create a joint hospital authority between the existing one in Southwest Virginia and the one that would be created in Tennessee. That's how that would work. So Rachel, this is what we were discussing previously. When I was still outside of Holston Valley, we were exploring the possibility of a hospital authority under existing legislation. That legislation could be amended in a way that would still work for all of Northeast Tennessee. And what I asked Kate was, would she be willing to look at those possibilities for amending that legislation and carrying it forward? And she says, yes, absolutely, 100%. A question that I got was, there's 2 questions. Kate, what's your opinion on the $500 million of Tennessee funds that's going for the Titans football stadium?
I personally think that we have so many better ways to spend that money, from infrastructure to public education that they're actively stripping, to supplementing small businesses and raising the minimum wage so that small businesses aren't hurt, and yet we can increase wages for workers. There are just so many better ways to spend that money than for a football stadium that, I mean, quite frankly, just benefits a few and is privately owned.
Got it. Answered. So Chris Bledsoe says, how can I volunteer to help you?
So the best way to do that is to sign up to volunteer. We're getting our on-the-ground crew going in the next couple of weeks, but we'll have volunteers doing phone banks, text banking, knocking on doors, writing postcards, hosting house parties, all the different ways to be able to go talk to voters. And before I give the website, I just want to say it's so important that as we're going into the community, we're having these hard conversations that are, why these issues are important, and telling people why you're supporting me. Because this isn't about me. This isn't about my name. This is about a movement. And this is about what joins all of us together. It's the values we share. It's why I stepped up to run, because I believe wholeheartedly in a community. So sign up to volunteer at Kate Craig, KateCraigTN.com/volunteer.
Awesome. So somebody else asked, do you have a meet and greet scheduled for the Kingsport area or anywhere around in there?
I don't. Admittedly, Kingsport's not in the district, but I am also the first congressional district chair for the TDCCA. Tennessee Democratic County Chairs Association. So I'm over at the Sullivan County Democratic Party headquarters and go to their meetings as well, just to be lent to support and help candidates that are running and all the efforts that they're doing. We do have a couple ballot initiatives up, so we're working to educate the public about that. And so I would come find me at a Sullivan County Democratic Party meeting.
Gotcha. So another question is, would that allow for competition? So somebody was asking about the hospital authority. And so, Kate, what would be one of the ways that you would look at to create competition in the area? Would you be looking to get rid of the certificate of need, or what would you be looking to do to allow for competition to come into the region?
Well, it'd be one thing I'd be looking to do that. I think that part of that key is expanding Medicaid so that you have money coming in to help bring money into these hospital systems, because I think that's also a little bit of what drove that merger. And so that funds were not part of that reason. And being able to untangle that, I think looking at what happened with the COPA as well. But I think step one is getting oversight and accountability.
Okay. So step one, oversight and accountability. I didn't catch the response about the certificate of need. Is that something that you would be looking to get rid of? So this, do you know what it is? Are you familiar with it?
I am familiar with it. I'd like to do a little more research in the sense of going, I'd like to talk to you specifically more about that, because I think that whatever needs to bring competition in needs to happen. And because I believe that prices would go down, patients would have better choices, and that the hospital systems themselves would be driven off of patient care versus profits.
Gotcha. Yeah, I'd be happy to talk to you about the certificate of need. I can also give you different physicians in different areas. So whether they are ballad physicians or otherwise, whether they are surgeons or private practice, there are physicians who would gladly chime in and tell you about the certificate of need and what it does and doesn't do. I would also recommend reaching out to HMG because they have talked about the challenges of certificate of needs and things like that. So that's another organization that would be able to give you lots of great information. Drew says, other than Gloria Johnson, we don't have many outspoken Tennessee legislators. How would you approach advancing the minority?
Sure. Well, minority can mean a lot of different people, so I don't want to talk about my position as a minority and not be all inclusive, but I'll speak to kind of talking about myself in that I'm a member of the LGBTQ community, and I mean the slate of hate that the legislatures have put up and just constantly attacking my community has just been awful, and they're doing that to communities across the board. So I think that working with advocacy organizations such as the Tennessee Equity Project, the NAACP, the ACLU, working with organizations, the Tennessee Equity Alliance, working with organizations that are registering voters, that are advancing issues and highlighting platforms to continue to raise awareness of what's going on with the book banning and what they're actively calling book burning. So we've got to, I would be just as outspoken as Gloria. I love Gloria, a good friend of mine. And because we got to be speaking out about this. And if it's not, I'm going to say a community I represent, elevating voices like Justin Jones and Danny Cook and others who are, if they're part of the trans community, if they're part of whatever community, because sadly the laws that they're passing to target certain communities have ripple effects or byproducts that they don't seem to care the consequences. That the CRT ban that they passed got a Sullivan County teacher fired. The anti-adoption law that they passed, that, by the way, all of these Rusty Crow voted for, that was meant to, in the anti-adoption bill, to target the LGBTQ community, stopped a Jewish couple in Greene County from adopting. So they're having unintended consequences that they just don't care.
Yeah, I don't even know if they're unintended. I just don't even know that I don't even know that they're considered. There's an agenda to some degree. Any other questions for Kate? I think Rachel asked specifically, what would you do to eliminate the Ballad Health monopoly?
This is where I would look in to bring competition into the area and looking at that certificate of need and doing more research on that, but looking to, like I said, I think step one is accountability while trying to unravel what's happened with that they have used this precedent of saying that the only way for people up here to have healthcare is with having a monopoly. And I don't think that that's true.
Gotcha. All right. So I got another one says, do you have any thoughts about the legislation working its way to the governor's desk that effectively criminalizes homelessness?
I have a lot of thoughts on this because Johnson City passed a piece of legislation, an ordinance just like this. And I think that it doesn't solve the problem, and it hurts people who are financially either they're houseless or they're financially struggling, and because any one of us could be in that place. And even if somebody is there for substance use disorder, we don't have the number of beds in treatment centers to be able to help. So you've just created this cycle where if you send them to jail, then they're not getting the treatment they need, because even if they're to get it, there's very few harm reduction / even medication assisted treatment in the jail. So people are suffering, and there's just this constant cycle. And quite frankly, if you find people that are homeless, how are they going to pay that anyway? So you've just created a cycle. And in 2020, they passed legislation that if you are camping on state property, then it's a felony and you lose your voting rights. And all of this came, was it in 2013, having to do with why am I blanking on what was the protest in the parks? I don't know why I'm blanking on it.
I know what you're talking about, but I don't remember.
But it had to do with the income inequality. And it's 10 o'clock and the word's failing me, and I apologize. But they did that. They created this piece of legislation then, and now all these anti-camping bans that they're doing are modeled off of that original legislation to break up those protests.
Sorry, I'm having to plug up my phone, guys. So forgive me.
Occupy Wall Street.
Occupy. That's it.
Yep. And there are federal courts, just not in this district, that are determined that these laws are unconstitutional. So I think it's a matter of time before it hits here, but they don't seem to care.
And the thing about a lot of these laws, they know that once the ACLU and other organizations go to fight them in court, they're going to be overturned. But they are good to stoke people up. They are good to bring in voters. But at the end of the day, they're going to be using your tax dollars to fight these things in court, knowing good and damn well they're going to lose. So a couple more questions before we wrap up. It says, Will Van Noy says, Kate, would you sponsor a bill to make emergency medical service an essential service and require more state funding for our emergency service providers?
I'd like to talk with you more of that, just to have the exact definition of emergency medical services. But as somebody who was in a motorcycle accident and was transported by ambulance to an ER for a trauma center and had overwhelming medical bills from that, I think that is essential services.
Awesome. So I will tell you this. So a lot of the EMS folks in the region are making like $10 an hour, things like that. And they are the first, they're the first responders to keep these patients alive. So it's ridiculous. So I know that Hawkins County was devastatingly impacted by budgeting and having to close down one of their EMS stations. And that's a problem throughout the region in terms of funding and EMS and all of that. So that would be interesting.
That's Unicoi County. I know Johnson County, they're weather dependent to get to Johnson City Medical Center by Wings Air Rescue.
Right. So listen, let me see if there's another one. Let me ask you guys this. Give me a thumbs up or a yes in the comments. If Kate and I came back and we scheduled a Q&A with Kate so that you all could ask more questions, find out more about her candidacy, more about her platform, more about what she would do. Is that something that you would be interested? Would you show up for it if I scheduled one of these and we came back? Would y'all be interested in doing that? Kate gives a thumbs up. She's in. I'm getting lots of thumbs up over here. I've got two different things going on. Lori says yes. Okay. So Sonia says yes. Awesome. So Linda says yes. Angela says yes. Stephanie says yes. 100%. Rachel says yes. Perfect. So Kate and I will get together on our schedules. We'll pick a day in the upcoming week. We will do a Q&A with Kate, and you guys can ask a ton of questions. I know that she's not going to be in everybody's district, but what we know is that what Rusty Crowe did impacts every single person watching this broadcast. So his seat is impactful. And so, even if she's not in your district, being able to volunteer, being able to talk to the people who who live in her district, being able to shift that movement is important. And so Somebody else said, yeah, because I want to hear your opinion on giving advanced practice nurses full practice authority. Yeah, let's talk about all of these things. So we'll schedule another date and another time. You guys that are right here, I'm going to turn you around so you're back in my face and get you out of my hand because this girl is tired. I want to recap really quickly before I get off here. I got y'all back on here. Oh, shit. I almost like closed y'all out. Sorry. All right. So first, let me say this. Kate, I appreciate you for being on for 2 hours to talk to people for 30 minutes. I do know that you care. The people that I've talked to that know you say the same thing. And I'm just excited to have somebody with a heart that has compassion, that is more interested in people than in politics, running for office, win, lose, or draw. I'm excited about that as a possibility. Jennifer, to you and your family, if you are still watching, I am sorry. We will do what we can with what we have. To the rest of you, please vote accordingly. I say that not caring about parties, but because what's happened to you and to the region is a travesty and people are paying the price. And it's important that you do something. I can do broadcasts and investigate all damn day. 10,000 people can watch this live. It's happened before. 180,000 people have watched my lives, right? But it's not going to change anything if you all do not contact CMS, if you do not contact the FTC, if you do not vote in your actual best interests and not along party lines. And I know that is going to be challenging for so many of you. But I would ask you, how many people have to die? I would ask you, how many more complaints are y'all going to have? You can't say nothing ever changes if you're not doing something to make it change. Okay. Kate, you want to share anything before we wrap this up?
Well, I just want to say thank you for having me. Thank you everyone for tuning in. And I'm always happy to answer questions. So if you think of something, I mean, please tune into the next live that will happen where Danny's very graciously offered to have a Q&A, but always feel free to reach out to my campaign at info@katecraigtn.com.
So Rachel Wolf says, I wish somebody would challenge John Lundberg. I agree with you. That's my mom's district. And I agree with you 100%. I appreciate you for coming, Kate. Honestly, I do. I'm going to take you down off here. I'm going to wrap up real quick with the folks and I'll see you back. All right. So listen, folks, we've had a long night together. I appreciate you for hanging in for all the time that we've been here. For the folks who don't understand why this is so important, I don't know what else to say to you. The proof is in the documents that I shared with you tonight. I don't find any joy or pleasure in reporting to you the things that I've told you. You all matter. Even those of you watching who don't like me, even those of you watching who can't stand me and think I'm the devil, you still matter. And I still want you to have access to safe, affordable healthcare in a reasonable time frame with a healthcare system that gives quality care and takes care of its people and whose administration does not create unsafe environments for its staff and its patients. I want to be clear about that. Hopefully, you guys get it. I appreciate you all. I'm going to get off of here tonight. Have a lot of emotion to process myself. I think that's it, right? That's it. That's it. Covered it all. I'll see you guys Tuesday night. Oh yeah, that's the reminder. That's a reminder. Tuesday night, if you want me to tell you about the tens and millions of dollars that Ballad got in COVID relief money, see me Tuesday night at 8 o'clock. I appreciate you all very much. Yeah, that's it. I'll see you guys later. Bella running by. She's like, Tutu's done. Don't I have amazing grandbabies? Because they were so good. I gave them snacks and got them fed. And I was like, give Tutu just these 2 hours, guys. And then tomorrow we'll do something special. Now, I don't know what that's going to be, but I got to figure out something to do for these babies because a lot of my hours this week have been dedicated to this. And they've been so patient. So I will see you all on Tuesday. Be amazing. Be light. Go vote. Contact CMS. Contact the FTC. and be love. Okay. Peace, guys. I'm out. Bye. I think I can close these out. Yeah.